Hi, welcome to Outlook, Providence Healthcare's podcast series. To get us started, Toronto resident Linda Drown, a caregiver whose husband Daniel uses our adult day program, shares some insight on living with dementia.
I'll just let you know that my husband and I both worked in healthcare all of our professional lives. And we found it much easier to deliver care than to need care. So in 2000, Dan was diagnosed with Parkinson's disease, and he was one of the unusual people who also started showing cognitive changes right away. So he was not diagnosed formally with dementia until about 5 or 6 years later, but I noticed changes right away in 2000. So for a caregiver, what that means over time is that we take on more and more responsibility. We do all the driving, we do all the finances, we do all the arranging, we act as translators at the doctor's office. It's really would have been impossible for me to know what my role would become, or for Dan to comprehend that. Over time, I became tired. One of the ironies of being in a caregiving role and having dementia as a part of our lives is that as time goes on, the demands for care increase. Sometimes they increase exponentially. And at the same time, the energy for the caregiver is diminishing because it has a cumulative effect. It doesn't mean there has to be a big drama. It's just a wearing away. It's exhausting. So when I heard about the program at Providence Villa about a year ago, it became highly recommended, and Dan and I came to visit. One of the first things that made me realize this was going to be a fine place is that they had a dog. It really touched my heart. Dan wasn't quite as impressed as I was, but I was thrilled. Dan started it 1 day a week, and that was such a help for me because the staff is so caring, and I could relax when he was here. I knew he was well looked after. Then he came one other evening a week. And again, that was helpful. So I knew for that period of time I could do things to look after my own health. I also started coming to the support group here that's professionally facilitated, and it's been wonderful for me. Dan and I, both when we come here, we get to be with people who are in the same situation. And that's not always true in our everyday lives. So it's a place for us to relax and to strategize for me and benefit from other people in the same situation. And the facilitator of the support group really is a cheerleader for self-care. It's not always easy to do that because the people that we love who have dementia, we just want the best for them. So this program has really provided that I'm afraid I'm a tough critic, given my healthcare background. So I don't say that lightly. It's really been wonderful, and it has helped me. Even when Dan hasn't come for the night yet, I do sleep better at night knowing that this program is in place and that I have more respite in between when he's here. So I feel honored to be asked to do this. I had just hoped that I could represent other caregivers the best way I could, and to honor this program that's been so helpful in our lives. It's really crucial in terms of us being able to maintain our own health and the health of our family. So I see it as being very important for helping us to be at home together for as long as possible. And I just thank you for giving me this chance to speak.
Thanks for tuning into Outlook. Keep an ear out for more podcasts and other ways for you to discover Providence Healthcare in our community. If you have an idea for a future edition, let us know by emailing info@providence.on.ca. Until next time, thanks for listening.